Hi, friends. Today we're going to look at 7 Medicare facts that you need to know. I'm Chris Prang, licensed agent based out of Charlottesville, Virginia. My goal is really simple, to help you make a wise and confident decision about all of your Medicare choices. So Medicare fact number 1, Medicare is indeed national health care. If you go to the Medicare website, it will tell you that it's national health care for a select group of people. Those that are 65 and over, obviously, those are on Social Security disability, or those that may have end-stage renal disease or ALS. If you look at the Kaiser Family Foundation, they have reported that 10% of the federal budget in 2021 actually went towards Medicare. So we've had Medicare since 1965. We've had national health care since 1965. Back in 2014, when I would show up on appointments, almost without fail, probably 80% of the time before I could put my computer bag down, people would ask me the same question. They would say, Chris, what do you think of Obamacare? And I'd say, well, we've had national health care since 1965 and you're on it. How's it working? And they go, oh, it's working pretty good. And that doesn't mean I'm in favor for Medicare for all or national health care for all, but I am stating the fact that Medicare is national health care. It's worked fairly well, and we've had it since 1965. Medicare fact number 2, Medicare does not cover long-term care, and Medicare wants you to know that it does not cover long-term care. What is long-term care, real quick? That means you can't do 2 activities of daily living, like transferring, going to the bathroom, taking your medications, getting food, things like that. And you need long-term care. You need somebody or some agency to help you out. Medicare covers skilled nursing for up to 100 days, but after that, there's no Medicare coverage, and they want you to know that. In the old Medicare new books, they would tell you 70% of the people will have some sort of long-term care need in their lifetime. But if you go to the Medicare new book, you can see very clearly under what's not covered under Part A and Part B, under that long list of X's there, one of them is long-term care. Then on page 56, it talks about paying for long-term care, and it says Medicare and most health insurance, including Medicare supplement insurance, don't pay for long-term care. And just to drive home the point, under skilled nursing care, it tells you at the bottom, Medicare doesn't cover non-medical long-term care. Medicare fact number 3, Medicare does not have a limit on what's going to come out of your pocket. This is especially important if you have chronic conditions or if you get a chronic condition or a disease. If you have a major medical plan now, or you've had one in the past through a group or retirement, whatever it may be, there is almost always a benefit called MOOP, M-O-O-P, maximum out of pocket, usually well into the thousands of dollars. But if you hit that, if you pay that much money out of pocket in a given year, when you hit it, you stop paying and the insurance pays 100% beyond that. Original Medicare does not work that way. If you look in the Medicare new book, it will tell you there's no yearly limit. Whereas if you get a Medicare supplement or you get a Medicare Advantage plan, then you do have that protection, and that protection is very important. Or if you had Medicaid, then you would be covered as well if you have the right level of Medicaid. Medicare fact number 4, Medicare is not free. It is definitely not free. Almost 3% of your income is Medicare tax. 1.4% paid by you, 1.4% paid by your employer, or if you're self-employed like me, you pay it all, 2.8%. And get this, if you make over $200,000 a year, well, you can add another 0.9% of your income going towards the Medicare tax. The average Medicare beneficiary has paid $60,000 into Medicare. Now, here's another kicker. If you pass away before you get Medicare, nobody gets that money. It's not like Social Security, where you can have a surviving spouse or child be able to get some sort of benefit from Social Security. Part B premium presently in 2023 is $164.90 per month. But if you make over $97,000 as an individual or $194,000 as a couple, well, hate to tell you, you're going to pay more. You're going to pay anywhere from $230.80 to $560.50 per month. Here's something really important, and this happens to a lot of people when they're coming onto Medicare and they're retiring. They start doing things with their 401k and their IRA and their investments, and they start taking out large lump sums, and all of a sudden, that's considered income, and it kicks you over that amount, and then you get hit with a penalty. So what Medicare and Social Security do, they look back 2 years to see what your income is, and then they base the penalty upon that. Thankfully, as long as your income doesn't say high, the penalty will go away. And if you make over $97,000, you're also going to pay a Part D additional premium as well. Part A is what we consider premium free, unless you didn't pay into it for at least 10 years. To get on Medicare, you have to have paid into the system, so to speak, for 10 years or 40 quarters, or been married to somebody that has paid in for 10 years. If you have not qualified for premium free Part A, then you are going to have a premium of $278 or $506 per month. Medicare fact number 5, you need to qualify to receive Medicare. A lot of people are surprised about that. Again, you have to qualify by being either 65 and over, be on Social Security disability, or have end-stage renal disease or maybe ALS. And again, as I mentioned above, that you need to pay Medicare taxes for 10 years or more or 40 quarters. Medicare fact number 6, you do not need to accept or have Medicare Part B, but who should that person be? You currently have group or will have group or retiree insurance after you go on Medicare. And you're going to keep working, or you got good retiree insurance, and it's financially beneficial for you not to have Part B. The thing to do is when you're approaching 65 and getting Medicare is to do a comparison. Find out what you're going to pay with just Medicare Part A and your group or retirement insurance, and then compare that to collecting Part B and adding on a Medicare supplement or a Medicare Advantage plan. Warning, if you do not take Part B at age 65 or when you are first eligible and you do not have credible coverage and you want Part B later, say 3-4 years down the line, you're going to pay a 10% penalty for every year that you have not had Part B. So be careful. A lot of people have got trapped into this and they didn't know it was happening. Medicare fact number 7, Medicare does not cover you while traveling overseas. So what are some potential solutions? So Medicare is not going to cover you. If you have a Medicare supplement, you could be covered up to 80% of your emergency or urgent care situation of up to $50,000, and this usually needs to take place within the first 60 days of being out of the country. You have a lifetime for ER and urgent care, again, of up to $50,000. Medicare Advantage plans can cover you up to $100,000 for emergency room or urgent care. And the way these typically work, if you're traveling, you have an emergency situation, you break your leg, you go to the hospital, you go to the urgent care center, wherever you are, you're going to pay the full bill. You're going to pay it all, and then you're going to submit claims to the Medicare supplement company or the Medicare Advantage company, and then they're going to reimburse you at typically the original Medicare rate is what they're going to reimburse. So that could be more, that could be less than what you've paid for. My suggestion is get good travel insurance when you travel outside the country that covers you for medical emergencies. So 7 Medicare facts that you need to know. Medicare is national health care. Medicare does not cover long-term care. Medicare does not have a limit on what can come out of your pocket. Medicare is not free. You need to qualify to receive Medicare. You do not need to accept or have Medicare Part B, and Medicare does not cover you while you are traveling overseas. So if you have questions, if you need help, go to my website, themedicareanalyst.com. A lot more information on there. There is a contact page that you can fill out and submit your question or ask me to reach out to you and contact you to schedule an appointment. You can call me on the number that you see there, 434-278-7234. The states I'm currently licensed in, obviously Virginia, North Carolina, South Carolina, Florida, and Tennessee, with more states coming soon. Lastly, how open-minded would you be to putting in the comment section below what state you reside in? That will help me to know what other states to get licensed in as I see people where they are watching from. Number 2, if you like the content that you see here, please consider subscribing. And number 3, if you do have a question, a suggestion, or a comment, please put in the comment section below and I will try to reach back out to you. That's it for today, the 7 Medicare facts that you need to know. Take care.